29:30 p.m., so we'll get started. This is the Board of Health for the town of Fairfield, and we will start with our agenda, which is the approval of the last meeting minutes. Entertaining the motion to approve.
I motion to approve.
Okay. Do I have a second?
I approve.
Anybody second the approval of the meeting minutes?
I can. Tracy Rinaldi.
All right.
Okay.
Thank you, Tracy.
Thank you.
All right. Any opposed? Hearing none, they carry, and so we'll move right into our reports.
Sure. So it's been a busy couple months, and I'll move quickly through it just because it's a bit of stuff. So we've been having a series of meetings. We had a meeting and a training on doing the Legionella case and interviews. So the health department is taking on the responsibility of doing community-based Legionella case interviews, and so had a training with the state. We've had several Medical Reserve Corps events. We have a series of planning meetings, and then we did a call-down exercise where we had, within 3 hours, had 38 responses with 30 people indicating an ability to respond in 3 hours, so it's still a pretty robust response. We participated in two different, there's a statewide Medical Reserve Corps assessment going on, and so there was two different meetings related to that, sort of a information gathering session and a workshop, and so we participated in that. We did have a training for our Medical Reserve Corps on the 12th of May, which we had 30 people sign up for, but we only had 4 people actually show up that night, so it was a little bit of a bust in that regard, but we'll continue to sort of try to engage the Medical Reserve Corps. We did have the Emergency Management Symposium. The Connecticut Conference of Municipalities puts this on each year, and some really good sessions on cybersecurity and hurricane forecasting, and they break out all the helicopters the state owns. They land there on the field, and then they have the different vehicles, decon vehicles and radio vehicles, and hazmat response, and bioterrorism trucks that can test for all sorts of stuff, and have National Guard people that are highly trained. So it's interesting to see and to learn and to feel like there's a lot of gear that we can bring to bear with a lot of these things. We participated in a panel on at St. Vincent's Hospital on youth service programs in the area, and we did have a meeting with about the community health assessment. So we just finished our last one, and we're starting the process of planning for the next one. And so there's a core group in the area that are we're referred to as the funders, the people that contribute financially to pay for it. And so we're looking at additional data gathering capacities and entities for going forward, just to consider different ones. We continue to have opioid settlement fund meetings, reviewing local data and sort of working towards putting in place a task force for review of how the funds are used. We're looking at an opioid mini grant program as one of the options. And we met with Fairfield University to do to engage them about doing a needs assessment for, the best utilization of the opioid funds in Fairfield. And so they're going to do some data collection and some key informant interviews and develop or their proposal is to develop a needs assessment for us to guide the task force when it eventually starts. We've started with what's called leave behind kits, where anyone who's overdosed, we have a package of Narcan and resources of when they're ready for treatment, how to engage with that, so that we have that for the police and fire, and the police social worker that typically goes out after the fact on any overdose case. And I think we had mentioned we got the Narcan cabinet here, and now we have several of the departments that have put those up as well. So we have, I think, 3 or 4 in town already. And so we're increasing, availability of Narcan. And then, so we're reviewing the proposal from Fairfield U, this Center for Social Impact from them, their organization. Continue to have some HR challenges, with the combination of the 2 part-timers into 1 full-time position. We actually had to lay off people because that's just the proper procedure. All the people that desire a position with the town will be hired back in different positions, but it was a process we had to go through of, notifying the union and preparing a layoff statement and stuff. So, but nobody's losing their job. But a few challenges there, a few resignations this spring of people taking other jobs, and so that Sarah's been very busy with that. We continue to do our different drills and exercises with, we have these UASC radio call down drills once a month. We've done a couple of those. We sat through a presentation on the long-term care mutual aid plan, which is evacuation plans for long-term care facilities, from the company that works with them to keep their plans up to date and to do exercises. We're starting with the state was notified that they got continued funding for preparedness for next year, and we've submitted a budget, and we're notified today that was the budget was approved, so we'll have another year of preparedness funding, so we can continue those efforts. We did participate in a presentation from the FBI on something I'd never heard of, nihilistic violent extremism, which is basically bad actors online convincing young, easily influenced children to do bad things to themselves and to others, and to some of it is just the swatting events of calling in fake bomb threats and things like that. They convince them to do that, and then they try to convince them to brand it with their particular acronym or symbol or number, and so it's but it goes very extreme, which I won't go into now, but basically they said they were doing a presentation around the state to sort of make people more aware that this is going on now. Very informative, but sad to hear about. And then we did have our Girl Scouts and Government Day, which was great. We had a couple young scouts look at some ticks under microscopes and do an inspection at one of the middle schools, and a salon inspection and a public pool inspection. It was great to have them. We have an intern for the summer from Fairfield U, an MPH student that'll be coming with us and doing our water samples and other activities. And then we've been having multiple CDC and state calls about Ebola, so there's some concerns there. It's the case counts are getting up there. There's we're still considered low risk in the United States, and they have travel restrictions in place where nobody who was exposed is allowed to leave, and so they're keeping people there for a 21-day quarantine period prior to letting them leave, and so that's been effective so far, and they're redirecting all flights from DRC or Uganda that originated in DRC or Uganda to 4 airports where there's intake screening from CDC staff. The hantavirus situation is still not resolved. There's no cases in the U.S. There was 7 people initially came before the restrictions were put in place on the vessel, and then 18 others came. There was 2 of them that developed symptoms while in flight that were taken to to Atlanta, and then they were later cleared of any hantavirus, and so they were brought out to Nebraska. And they're down to a few of them have gone home and are being monitored by the local health departments, but there's still 13 individuals trying to finish up their quarantine. They'll be there till June 21st is the final day of the quarantine period. Again, the CDC keeps saying low risk United States. We were very knowledgeable on this disease, and that to expect other hantavirus Sonombre strain to be popping up in the news because it's very typical for the United States to get that strain, but it is, because of the other things that are going on, it's probably going to be a heightened concern about that. We did have, Santa and I met with a consultant for a new strategic plan. We received a quote today, which we're going to review. But, that's one of the options we want to consider. And so we'll consider that as we're going forward. And then we did have several staff participate in Bike to Work Day on the 28th. And so, including the selectmen and chief of staff and several others, we met at Sherman Green. And so it was a nice little event there where there was one of the coffee shops set up free coffee and, but they still expect you to make it into work on time. So that is my report.
Great. Thank you. Any questions for Sam?
I have none.
All right, hearing none, Cynthia.
Okay. So we've also been pretty busy. Last month we did a series of QPR training. So it stands for Question, Persuade, Refer, and it's suicide prevention. And so we did 3 of those trainings last month for Mental Health Awareness Month. So we did one in the evening on 5/11 at the Fairfield Library. We had 15 people show up. And then we had one on Thursday, 5/14, in this room during the day. We had 18 people show up. And then we did one for all the school nurses on 5/19. We had about 30 school nurses in Fairfield to come to that one. And it was really well attended. We're hoping to do more. The problem with that program is it does require 2 facilitators, and so you have to be trained in it to deliver the program. So it's myself and Julie McCullough, who is unfortunately part-time, and she's also the public health nurse, so to get our schedules coordinated. But we do plan on offering more of those, hopefully one this summer and then definitely in the fall. And Emily Larkin, who is the youth social worker in town, is also trained on the program. So her and I have had some discussions and maybe how can we take this to the youth, because that's what we heard from a lot of the parents that came is this is great. I'd love if my kids can be trained in it. So those have been some discussions. On 6/2, we had a Nutrition for Seniors talk. So Yale New Haven Health had some extra funds, and we were able to get the Yukon Extension to come to the Senior Center to do a talk with our seniors on cooking with herbs. And it was so well attended. We had 19 people show up. They loved it, so we're hoping that we can get them back. It is a little costly, so I did have some discussions with the Senior Center on if we can't get funds from Yale New Haven Health, how could we potentially bring this to the seniors. So when I was talking to Yukon Extension, she would love to do something once every quarter, and she does do this throughout the region. So she said it would be great. She can kind of take a little roadshow to each town. We do plan on having Matter of Balance in July and August. So that is our fall prevention, or the Fear of Falling Prevention program with our seniors. So again, myself and Julie McCullough will be delivering this program. It's 8 weeks. It meets once a week for 2 hours. And it's probably one of our most popular programs. Unfortunately, we can only hold a max of 12 participants, but it is usually well attended. And speaking of Julie, we're already starting to think about flu clinics, which is crazy because we're in, the middle of June. But the Senior Center does book up pretty quickly, so we've started to kind of look at the calendar and decide where we want to go or what days we're looking at for October. Sarah and I attended the Fairfield Youth Needs Assessment roundtable discussion. I think Nina was there as well. And basically, Emily Larkin, the youth social worker, went around to each department and kind of conducted this youth needs assessment. And so this roundtable discussion was the findings of that. Really, it was one of those meetings where I wish it lasted a little bit longer because it was such a good discussion, such good information. So really looking forward to what comes out from there. As Sam's mentioned, we do have the intern doing water samples. Right now, she's inputting all of our QPR data for us, and she's going to be working on a project with the First Select Person's Office, Pedal to Past. So they also have an intern, and so the 2 interns are going to be working on this bike project. Social media, we are continuing with alerting people about rainfall and when the beaches are closed. That tends to be our most popular post this time of the year. But, we're also pushing out messaging on safe swimming, heat, and then every now and then we'll sprinkle in some stuff about measles and any other things that are going on. And then a big chunk of the last few weeks has been our annual report. I can go into that now, or do you want me to wait until we get to that part of the agenda?
Later on the agenda.
Probably makes sense to go on to business, yeah.
Okay.
Just a question on the QPR.
Mhm.
Is there, I don't know what it takes to become a trainer in terms of like time investment, but is there a potential there to partner with the schools and like the school psychologists and using them, and then, you have them, you can work with them and expand it to more of like the high school kids, middle school kids?
Yeah, so it is costly to get trained. I think it's $600, if I remember correctly, to get trained in the program. But yeah, that's a thought, is just to kind of even see who might have been trained. So a few years ago, the state was offering free trainings, and that's when myself and Julie got trained. So I think that's part of like the discussion, is figuring out who has been trained already and where can we tap into those resources.
Or even some grant funding to pay for the training.
Yeah, absolutely.
There's some private organizations out there that would value it and
Yeah.
the funds.
Yeah, absolutely.
Cool. Any other questions for Santina? All right. Hearing none, I think communications is next.
So there was an email sent to the board. It was an individual in the waste management field and requesting if he would be able to do a presentation to the board on his service and product, and which he believes is an improvement in the sanitation industry. It's so I thought I would bring that up to the board to see if there's an interest. I think we haven't done anything like that to hear product pitches at this meeting, and if we did one, we'd probably have to entertain anyone who wanted to. So I would put it to the board to see if there's any interest in listening to this gentleman's presentation on sanitation.
I mean, I guess I would want to know what's his end goal in meeting with us, right? I mean, we're not going to buy a product from him, and so what's the goal?
I think it would be to be supportive of his it's basically a different type of, rather than dumpsters, it's in-ground receptacles, and it's supposed to be cleaner and more sanitary and less odors, and so he's basically wants to sort of promote that in this area, which I think is fine, but we can't recommend one particular product over another, and so I think it's going down a slope that but it's really up to the board whether they want to have something like that at a board meeting.
I'm going to interject something because in one of those Moms of Fairfield posts where it had come up, when there was a lot of the waste management problems that people were concerned about on Blackrock Turnpike behind a certain establishment, with accompanying photos, and then you did resolve it right away. I guess the big question is, it does seem like a little bit of a frustrating thing, though, that it's like I know it's not the Board of Health, but it's the health department that is responsible for maintaining a certain standard, right? And so it seems, I know that oftentimes in many organizations, even though you're not necessarily saying this is the one to go with, it does seem like some sort of acknowledgement that other things exist and that there's other options available is important. It's really just like education, more sanitary conditions, because it's like completely sealed underground and eliminates that above ground problem. I mean, I'm not sure if it needs to go through Board of Health or needs to just go, to me, it should go like directly to the health department, so that if someone is having a persistent citations, that, you know, they can be educated that there are other options that might help to alleviate the problem, you know? I mean, this just came up and I'm sorry if I didn't see that. I don't know if that was written on the agenda. I apologize. I came right from work patients to kind of grab the call here. Otherwise, I would have thought of better analogies. But, you know, I just think like a lot of times in life, we kind of just do the same thing again and again and again without necessarily innovation, like certain products. And sometimes other things come out and there's like a super slow learning curve for people to be made aware of what other options are, because they just always go with what is in the forefront. You know what I mean? The most typical, traditional. So I'm not sure the best way to deal with it, but it seems like, you know, perhaps there should be an outlet, like an education piece to the Department of Health so that they can provide better options. You know what I mean? Or alternatives for persistent violators. You know, I mean, I'm sure there's things that you have to recommend and inadvertently recommend certain products, you know?
So I'm all for, Mark, go ahead.
I just wonder whether or not, like, the same way that we, you know, in my office, we don't have drug reps come anymore because I just don't like the sales pitch. I don't like any of that. But if they have printed material, if they have information, I'm happy to look at it. I wonder if he had, and if this person had anything that we could actually read or look at without having to have them here personally giving like a sales pitch kind of thing. I wonder if that would be a better way.
There's links in the email that was sent.
Yeah.
So I believe it was sent to all of the board, you know, it was sent to the Board of Health email.
I didn't receive it, so I think
Okay.
Well, and to me, I think it needs, the people it needs to get to are, you know, the sanitarians, like people who are actually going on site, reviewing places, and maybe, you know, again, the best analogy I can think of is like when I was, you know, working in home health care, and hospitals, for example, are giving, okay, here's a list of 10 home health care companies that you can go with, right? Here's a list of X, Y, and Z. So it's somewhat neutral, but then it's also just providing other options so that they can possibly remedy the situation, you know? So that's all.
Yep, okay.
Yeah, I mean, I'm all for, you know, members of the public coming with the board, for sure. I don't know about sales pitch necessarily. I think if there's some value to the board in them coming, then I wouldn't mind, but we're certainly not gonna buy the product, and it's not.
Yeah, I mean, the issue for us is like
move the product along, you know, so I'm not sure there's
we're not decision makers on the Board of Health, you know? That's the problem. We aren't
So I don't know if the
decision
value
makers.
is there for him, but I mean, in general, I would support members of the public speaking to us. So, I mean, I would leave it to the will of the board if they would like this gentleman to come or not. I mean, I could go either way on it. I mean, I'm with Mark in general when it comes to the workplace and the reps. I don't let them into my department either, but, you know, again, leave it to the members of the board here. If they want to hear from him, then happy to have him in. If not, then...
Well, perhaps as Ms. Connolly suggested, you know, I'll have a conversation with them, you know, internally with the department, and make the sanitarians aware of the product. And we'll leave it at that. I think that, you know, being aware is always, you know, we're always up for that, but we try to be cognizant every day. We're cognizant of not recommending one product or service over another. Okay.
My only follow-up to this would be, I think this is the second time in the last couple of months that we haven't received an email that went to...
I'll look into it. Okay.
Doesn't like none of us received that one.
Yeah, I'll follow up, because I did put a ticket into IT to correct have certain, to make sure all the emails were updated, and I thought they were, but I will make sure that's done.
Thank you. Any other communications?
There was none?
Okay. Next, we have any old business?
We have none?
All right, and now we have new business.
Okay. And Santini, you want to present the standard operating guide? We had discussed this before about, the policy on branded and promotional items that are donated to the department. And so this is kind of solidifying what we discussed.
Yeah, so just essentially, if any staff receives any donated branded items, it kind of needs to go to SANS for approval, if that's something that we're allowed to hand out. So, for example, if the nurses receive something from, CVS Minute Clinic, that would need to go to Sarah or to SANS before they start handing things out, because we don't want to make it seem like we're promoting people to go to a certain organization or anything. We kind of went into the discussion. You can really get into like the nitty gritty of this stuff of, the Colgate toothpaste. Do we want to hand that out? Does it matter the brand, the Band-Aids that we hand out? We then decided to leave it to branded items for profit entities are not permitted. So that's just kind of the steps that people would go through, and then we put in examples that are allowed and not allowed. So for example, if we get donated water or food or something like that, that would be something that
during an emergency event, like we have grocery stores donate ice and water bottles and things like that.
And then of course, like any sort of educational materials from like the American Heart Association or things like that would be allowed. But again, that would go to SANS before we would allow anything. And so that's it.
So like always, she puts it all on me.
Yeah.
Well, as I suggested last time we spoke about this, not an easy project. Wasn't envious of your task here and putting this together, but I think it came out nice.
Thank you.
Okay.
I think it makes a lot of sense in my mind.
Yeah, that's great.
A lot of latitude there were needed with some clear guidelines.
So we'd ask for a motion to approve the policy on, or the standard operating guide on distribution of donated or branded items.
Do we have a motion?
So a motion, let's say that again.
A motion to approve the policy on distribution of donated or branded items.
So I would ask to make a motion to approve this policy for receipt and distribution of donated or branded items.
Do we have a second?
I can second it.
Tracy?
Tracy.
Is that Tracy? Okay. Thank you, Tracy.
Any opposed? All right, hearing none, the SOG carries. Thank you.
Thank you.
Thanks very
Nice
much.
work.
That's really very good.
Thank you.
And second order of item of new business here is the annual report.
Yep. So we worked on the annual report. So this is last fiscal year, so July 1st to 2024 to June 30th to 2025. There's like our 10 essential services, our mission, vision, and values. This is our new updated organizational chart, and then a little bit of an overview of what each division does in the health department, and then a whole section on community health. I just want to point out that in that fiscal year, we did 314 social media posts in 365 days, which I thought was pretty impressive. We gained 96 new followers, and we had an increase in engagement in our posts.
Reach of 160,000 in that, just on our stuff.
Yep. So a little bit more on community health and our partnerships. Our grant that we've talked about, our immunization grant, highlighted that.
The 3 campaigns had 17 million total impressions of those 3 campaigns.
And then these were the top reported conditions, so NCT eds. This is, again, all that's reported, but this is what, we were kind of going through. So 2,858 reported diseases to us. And then just, some trends. So the pertussis, this is when we had that outbreak. But, I like to looking at the Lyme because, that's something that a lot of people are talking about right now.
So we're trying to show trends over the last several years.
But a drop off from number 3 to 4 on the list though, right? From like 800 something to 26 cases or whatever it was,
Yeah.
Like on the slide prior. The top 5 list there.
Yep.
Yeah. Very healthy community overall.
So then we highlighted our environmental. So in total, they did 1,544 inspections. And then I liked this graph. We're talking so much about the rental properties that are coming up. So that has increased by 107.5% in the number of inspections. And then here's all of their complaints that we get, and then their environmental health services. So that's, the ticks, the foodborne investigations, the radon tests, lead cases, and then our public health nursing and our school services. So they're 108,560 visits. And the one that Sarah and I kind of liked was the medical procedures and the medications administered, because, going to the school nurse is no longer for like an ice pack or a Band-Aid. Like there's a lot of stuff going on there. So we highlighted the medications administered. So you can see that's increased by almost 36%. And then our public health nursing services, so all of the vaccines. So we had 22 flu clinics that year. That is when we had our grant, so it is higher than what it normally would be. But we gave out 1,300 flu vaccines, 271 COVID, 10 RSV and pneumonia. We did 37 homebound. This is the Well Child Clinic. These are all the vaccinations that we administered. So, that's hepatitis, Tdap, varicella. And then when Sarah had In a Heartbeat come, 485 kids were screened and 3 were identified and referred to cardiologists.
When they did the
echograms, yeah.
Echocardiogram for that many kids.
And then our public health emergency preparedness, all of the events that they had throughout the year, and then these are down in the right corner, like all of the monthly meetings, basically. And then that's it.
All right.
So we'd ask for a motion for approval of the annual report for fiscal year 2025.
So motion to approve the annual report for this year, 2020, 2024, 2025.
Do we have a second? Anyone else?
I can second.
Thank you. Any opposed? All right, hearing none. The report carries. Thank you. Nicely done.
Thank you.
It's just very visually appealing and, I think great factual information, but brief to the point with, the graphics kind of popping out, the important highlights there, so.
Thank you.
I'm curious, is there like a format that all towns kind of follow, or is this like just homegrown, or how did this come together?
So this report in particular, I found like a template on Canva, and so I just kind of did that.
Like for the information.
For the information, that's all ours.
Yeah, I mean, it's
No, I mean, like, do all towns have something very similar with the same kind of facts, or?
Similar.
They require, like, what goes into these reports?
There's no standard, but I think what we've been trying to do, basically at the suggestion of the board for a number of years is to sort of, the questions you've asked about trends. Show us trends and show us what's changing. Show us, summarizing and presenting the good work that the department does, of all the communicable disease investigations and vaccinations and how many, 108,000 nurse visits and 15,000, medications administered are numbers that, tell a story of what we do and that, we're accomplishing a lot, and is the sort of guidance that the board has given us over the years. So each year we try to improve that, and I just have to commend Santina because I will take absolutely no credit for this, other than some guidance. She and her team was in charge of all the graphics and, bringing it to life. I think this is a step up in sort of graphical representation, which, I think is important nowadays in some of the reports, to be able to have something you can look at it and say, okay, I get that and understand it and see the trend, and so.
Yeah, I mean, and even when you see it like this, it's one thing to see a number, but then when you see it graphed out, because Sans and I pointed out the 314 posts, and Sans said, is that the whole year? And I was like, yeah. And then it kind of makes you think, like, we are doing work on Saturdays and Sundays, right? And we are getting the message out whenever we can, or we're doing multiple posts in a day. So I think that, kind of tells even, like, the dedication of the staff to the health of the community.
Yeah, absolutely. Great work.
Thank you.
So there were a lot of, the flu vaccine was great, but you said that because there was a special grant, we're not going to be able to have
The number of clinics, so.
The number of clinics.
So it'll be less for this coming year.
We'll probably do the same number, close to that. That's pretty close. What happened is we offered more clinic opportunities.
Right.
And so we think it kind of spread out across multiple clinics, rather than we usually do 2 or 3 big clinics, where we vaccinate 600, 700 people a day.
Okay.
Or
we still have
more.
the capability of doing a
Yes.
substantial, that's great.
Yes,
Correct.
we always, every year we always do a mass vaccination clinic, just to preserve that capacity and teach the
Right.
staff of how to do it, how to move people through, and how to, be efficient at it.
Yeah.
Great.
And we were still able to do homebound visits this year, even without the grant. So the nurse that was on the grant is now a part-time public health nurse, or school nurse. And so she said she enjoyed it so much, she asked if she could do it again, and we were able to fund that. And yeah.
It's a great service to the community,
Oh,
it was so appreciated during COVID, that we just wanted to continue it in whatever way we could.
Mm-hmm.
That's great.
Yeah.
Thank you very much.
Thank you.
Okay, any other new business?
We have none.
Okay, we have a motion to adjourn.
Motion to adjourn.
We have a second.
4 minutes.
Tracy?
Here in a second. Any opposed? All right, hearing none.
All right.
We're adjourned.
Jason? All right, thank you, everybody. Let me turn off the recording. Thank you, Sally. Thank you, Tracy.
Okay, thanks all. Thank you.
All right.